The renal capsule is a smooth, thin, hyperechoic line on ultrasound. The renal cortex is the outermost layer of the kidney and contains fibrous capsule of the renal corpuscles, collecting tubules, capillary beds, and the proximal and distal renal tubules. The renal cortex is usually hyperechoic compared to the medulla and isoechoic compared to normal liver parenchyma. Normal renal cortex is usually slightly hypoechoic compared to normal splenic parenchyma. Renal biopsies are taken from the cortex. The medulla contains interlobar blood vessels, some of the loops of Henle, and the main urinary collecting ducts and tubules. Because of its increased fluid content, the normal medulla is hypoechoic compared to the cortex, but not anechoic or pure black. The medulla increases in size with diuresis from fluids and diuretics. When instructed to withhold food for 12 hours before an abdominal ultrasound exam, some owners withhold food and water. This can cause generalized dehydration and affects ultrasound image quality for the entire abdomen. Normal dehydrated animals may have a relatively hyperechoic renal medulla due to decreased urine flow. Normal dehydrated animals will have an elevated urine-specific gravity, but normal BUN and creatinine. Because of the extensive vasculature, renal medulla should not be biopsied. The renal crest is an extension of the medulla and best seen from a lateral transverse transducer position. The renal crest is lateral to the renal sinus and has multiple openings to allow urine from collecting tubules of the kidneys to drain into the renal pelvis. The renal pelvis is a thin chamber contained within the renal sinus and is not usually seen on ultrasound unless it is dilated. Urine passes from the renal crest into the renal pelvis and from there to the proximal ureter. The renal sinus usually contains fat, which may or may not cause an acoustic shadow. Fat in the renal sinus usually obscures visualization of the renal pelvis and proximal ureter on ultrasound. Urine flows from the renal crest into the renal pelvis and then to the proximal ureter. The renal hilus is a depression or indentation in the center of the medial side of the kidney. Renal nerves and blood vessels enter and leave the kidney at the renal hilus. The ureter also leaves the kidney at the renal hilus. In dogs and cats, ureters are not usually large enough to be seen on ultrasound unless they are dilated or obstructed. The main difference between cats and dogs is that older, normal cats can store fat in the proximal renal tubules of the cortex, causing the cortex to appear hyperechoic compared to normal liver parenchyma. Hyperechoic cortex in dogs is abnormal. Normal blood vessels of the kidneys are anechoic on ultrasound, as are the lesions of cysts, dilated renal pelvis, dilated pelvic diverticuli, and dilated ureters. Color flow Doppler helps to identify blood flow and differentiate between normal anechoic blood vessels and anechoic lesions. With color flow Doppler, red shows flow towards the transducer, towards the top of the ultrasound screen. Red color usually indicates arterial flow in the kidneys from this transducer location. Blue shows flow away from the transducer, towards the bottom of the ultrasound screen, and usually indicates venous flow in the kidneys. The main renal artery and vein are seen outside of the hilus of the kidney. Medullary interlobar vessels are arteries and veins that radiate through the medulla and connect to the arcuate vessels. Arcuate vessels are short, hyperechoic lines or small circles at the corticomedullary junction, which sometimes show acoustic shadows but are not mineralizations. Arcuate vessels mark the junction between the renal cortex and the outer region of the medulla. Arcuate vessels curl along the corticomedullary junction and connect to the cortical interlobar vessels. In chronic kidney disease, the medulla often becomes hyperechoic, and it is difficult to differentiate cortex and medulla. Color flow Doppler can be used in these cases to locate the arcuate vessels and identify the separation between cortex and medulla. Cortical interlobar vessels radiate into the renal cortex. Power Doppler can also be used to show the presence of blood flow in the kidneys. Power Doppler will not show direction of flow, but tends to detect lower velocity or weaker blood flow. Power Doppler can also be used at deeper depths in cases where color flow Doppler does not detect blood flow. Every kidney should be measured by length from cranial pole to caudal pole. The width of each pole can also be measured. Normal cat kidneys should be 32 to 44 millimeters in length and 22 to 31 millimeters in width. Because of the wide variation in dog size and weight, there are no normal tables of kidney measurements for dogs. Measurements of the left and right kidneys of a patient should be compared to each other. The measurements are usually similar but seldom exactly the same. Sometimes there is quite a difference between the length of the right and left kidney. This should only be of concern if the kidneys do not look normal or if the patient has symptoms or an abnormal urinalysis. In one study of cats, the difference in length between normal left and right kidneys could vary by as much as 13%. The same is probably true in dogs. Lesions, such as size of cysts, stones, or width of a dilated renal pelvis should be measured for comparison in future ultrasound exams.